Hello, my name is Deidre Mays, and today I will be discussing lupus. What is lupus? Lupus is an autoimmune disease that attacks different organs and systems within the body. It can last anywhere from 6 weeks to a various amount of years. Lupus affects everyone, but mainly women in the childbearing age. Many different types of lupus occur, for example, neonatal lupus or drug-induced lupus. The causes. The exact causes of lupus are unknown. Many physicians believe it can be caused by the environment, genetics, sunlight, certain medications, and infections. And here I have pictures of different medications and very bright sunlight. Signs and symptoms. The signs and symptoms of lupus include fatigue, fevers, nausea, vomiting, dizziness, memory loss, bladder infections, protein in urine, butterfly rash on the face, hair loss, feet swelling, leg pain, sores in the mouth and nose, blood in urine, inflamed organs, and puffiness in the eyes. And here I have a very dizzy character, one of the side effects of having lupus. The short-term and long-term consequences of lupus. The short-term consequences are bladder infections, stomach ulcers, and anemia. All of these things can be cured or go away over time with medication. The long-term consequences include kidney failure, cardiovascular disease, bladder complications, and spleen removal. All of these things occur over a very long period of time and are more than likely going to cause a major effect in life. Treatment for lupus. There are several different treatments, starting with the anti-inflammatory medications, which stop so much flare-ups from occurring. There's surgery to get certain organs removed and corrected. There's vitamin D supplements that go hand in hand with one of the causes that people do believe, which is the sunlight. There's also steroids. There's acupuncture, which is a type of Chinese study where you stick needles, and that's what I have a picture of right here. And some people believe it reduces stress. And then there's also organ transplants. Living with lupus. Managing symptoms is the most important when dealing with lupus. Many people with the disease want to manage their symptoms and the pain they have, and starting with one after the other, that will help them tackle the disease. Many people have a plan with their doctor to combat the disease on their medication and their routine day-to-day living. One thing people do is catch the flare-ups right away. That will help them from going through so much pain and reduce trips to the hospital. People also focus on the positive, which could be anything in life that causes them happiness, and also reduce stress as much as possible. The less stress you have in your life, the less chance you'll have of having a flare-up. And these are my references. In conclusion, I feel like lupus is a very sad disease, but if someone learns how to manage them properly and have a great plan with their doctor, they can get through it just like you can get through anything in life. I had a classmate who had lupus, and I've known her since middle school, and she tends to focus on the positives and building a great relationship with her children and her husband, and it helps her get through day-to-day struggles and makes living with the disease much more easier and manageable. Thank you for your listening.